Losing a massive amount of weight has many advantages. You can improve your high blood pressure, your sleep apnea, your cholesterol, your mortality, and a lot of people are doing it through different means. They're doing it through gastric banding, they're doing it through the gastric bypass, the gastric sleeve has really gained in popularity, and diet and exercise causes people to lose a lot of weight. But one of the things that doesn't get better when you lose that much weight is the excess loose skin that you can have. And oftentimes people have a plastic surgery consultation and desire to have some of that skin removed. Now, whether that skin is covered by insurance to get it removed is a big question. And what the authors look at in this paper is the current landscape in terms of abdominal operations, such as a panniculectomy, which is removal of that apron of skin below the level of the belly button. They want to know whether that's covered and what are the typical criteria on which that is determined by insurance companies across the country. Some of the common things that they look at, these insurance companies in this paper, is rashes, or symptomatic problems that people are having. The most common things that I see in my practice is that patients need to have rashes for more than 3 months and be treated with prescription creams, and the rashes can't get better with time. So it has to be a persistent problem or else insurance companies just aren't going to cover it. Another criteria that insurance companies are looking at is whether it causes you a severe functional problem. So if that pannus or extra skin in front of you gets in the way of your mobility, then that's important to tell your doctor, and it needs to be well documented for insurance coverage. Another thing that the insurance companies often want to know is how far out are you from your weight loss. So if you had the gastric bypass or the gastric sleeve, they want to know that you're at least 1.5 years out. Some insurance companies require you to be 2 years out from that procedure. And the reason why is because after you lose the weight and dip down to your lowest point, you often plateau slightly higher. And so they want to know that you've leveled out. And the other criteria they often want to know is how long you've been weight stable. So they want to know that you've been stable for at least 3 months before you were to have a body contouring operation. Some insurance companies want to know that you have lost a certain amount of weight. Now, every person's different. Some people carry all their weight in their thighs, and so their belly may be small, or some people have very large pannises and have very high BMIs. And so there really shouldn't be a cutoff per se of BMI when you assess a patient, but a lot of times these insurance decisions need to be made on a case-by-case basis, which the authors talk about. The authors also look at other areas such as the lower body lift or circumferential abdominoplasty operation and how often the insurance companies across the US cover that. Now, they use CPT codes such as removal of skin from the hip or the lower back, and some plastic surgeons may use different codes such as removal of buttocks or thigh tissue for those circumferential procedures. So it's hard to tell whether the information from this paper accurately reflects what's going on with your surgeon and your insurance company. Now, some people have true saddlebags that are really, really large and cause major functional problems. Then sometimes those can get covered by insurance, but it's less likely. The authors also looked at liposuction, and that's rarely covered. It's often almost always considered a cosmetic procedure, but again, you can check with your insurer about that or have your surgeon's staff look to see what exactly is covered for you. So it's important to ask your doctor exactly what procedures they're going to do. Now, in my practice, I'm in Pennsylvania. I typically can get pre-authorization on moving the belly button. And so insurance companies do reimburse for that, but there are many that do not. And so you need to find out from your doctor whether or not that's covered. Some physicians may charge an up fee or a cosmetic fee to move the belly button or to tighten your muscles. And that's pretty standard across the United States. So some of the key things you want to ask your doctor when you go in for your consultation is, where's my scar going to be? Are you going to lift the pubic area up for me? Is the belly button going to be moved? So no matter where you are on your weight loss journey, congratulations on losing the weight. It's a great achievement, and not only is it improving your health, but it's going to hopefully improve the way you look and feel overall. Congratulations.